Hi Linda.
Hi Ashley.
Today we're going to be going through how to take the observations for a patient, just the vital signs this morning. The first thing we want to do is obviously practice our hand hygiene, which we've already done this morning. And secondly, I'm going to identify the patient and introduce us to the patient so that she knows what we're doing and who we are.
Okay.
So I'll get you to go around the other side so you can check the wristband for me. Good morning, Marilyn. My name's Ashley. I'm here to take some vital signs for you today, and this is Linda. She'll be helping me out. So what we'll do is we'll just check the wristband. We have Mrs. Marilyn Hughes.
Mrs. Marilyn Hughes, 22nd of September 1927.
Beautiful. No worries, Marilyn. So next thing we're going to do is obviously make sure the patient's at the right height for us. So the bed wants to be at a nice steady height at the hips of the shortest person here. So I'll check it on you because you're a little bit shorter than me. Looks good, so we can leave it as it is. Now we want to just release this rail and let that down so we can actually access the patient. Okay, Marilyn, so I'm just going to be taking your observations. First things first is we're going to check for the pulse. Now, normally with the first time of seeing a patient, you would take this for a full minute. Also, if there were any issues with the pulse, like irregularity, you would also take it for a full minute. I've already seen this patient this morning, so we would just be doing 30 seconds. So what we'll do is I'll just time it. The radial pulse is located just under the thumb. So you can just have a feel of that.
Oh yes.
Yep. Nice and steady and even. Well done, Marilyn. And we're just going to count that for the 30 seconds. Okay, so we've got the pulse. I've got a pulse rate of 72, which is around about average. It's usually between 60 and 100 is fairly regular, so long as the beats are consecutive and nice, strong feeling. Okay, now the other thing we're going to do is while we're doing the pulse, we're going to take the respiration rates. That's basically the amount of times the patient breathes out in a 30-second period. The best way to do this is usually to continue on with your radial pulse so that the patient is not aware of you taking the respiration rates. Quite often subconsciously somebody will change their breathing patterns when you're watching them breathe. So it's much better to just continue on with your pulse whilst you're counting the respiration. So we're just going to do that now. Okay, Marilyn's got around about 25 respirations in a 30 second block. Okay, now moving on to temperature. We also need to take her temperature today. So I'm just going to get my thermometer and make sure it has a cap on it for hygiene reasons. Obviously we don't want to be infecting other patients with other patients' ears. So Marilyn, we're just going to take your temperature today. Now this little machine beeps, so we'll just place it in the ear facing towards them. And press the button. It's very easy. And that's fine. So we've got a temperature of 36.7, which is a pretty good temperature. Okay, thank you very much, Marilyn. That was nice and easy. Just pop the bed rail back up. And now I'm going to go through recording.